It's understandable that that anybody who actually looks at patient opinion for the first time will immediately see the challenges ahead. Those challenges are very much about people's perception of the risk of exposure of individuals, especially when there's actually a complaint or a person's actually not happy with the service they've received. I feel that patient opinion has worked very well with our staff to actually allay those anxieties and fears, and also that we've helped to change patient opinions, policies and procedures throughout the project. As a trust lead for the patient opinion project, I came about some very interesting attitudes and opinions very early doors, and it was interesting how staff had real fears and anxiety about being identified through a website, and they felt that they themselves would actually face possible recriminations through the particular postings. This was something we worked through with them, and actually by working and talking to other trusts who've actually already experienced patient opinion services, we were able to actually allay those anxieties. Again, within mental health services, there was lots of fears initially about the fact of how real and how quick the time was because of the postings, and if people were wanting to use it as a bit of a chat line where people would be posting about their immediate feelings. And again, we allayed the fears by involving service users and carers in the early developments of the service. Part and parcel of the developments within the trust was actually gaining the confidence of managers and how they would actually respond to the real-time postings. And for us, it was about trying to educate them that it wasn't just about responding to a letter like you would do through a normal formal complaint, but it was very much about how we could open the dialogue, and actually that dialogue would actually be about explaining what the trust does now and how it would do things in the future, but also for opening doors about other services we have within the trust, which could actually be a formal complaint, or it could be a compliment, or it could actually be further contact with our local PALS service.
I think quite naturally, when we started using patient opinion, or when we made a decision to use it, there were a lot of fears. No one likes saying, how am I, how did I benefit you? Because all of us think it'll come back and they say, you were rubbish and we didn't like it. And it's not like that. Over half the comments are positive. And I think that's something that we often don't pick up in the NHS. One of the fears we had was that we'd be swamped with comments, that we'd be getting hundreds, thousands of people sitting at home and typing in the keyboard, and that's not happened. If only it would. It's a steady stream of comments. We were also scared that maybe some of them would be vexatious. There'd be people who've wanted to complain for the sake of complaining. That's not happened. There's not a single comment, and people, as I keep saying, can look at our site on patient opinion. There's not a single comment where I don't look at it and think, yes, I can understand that. But like everything else in PALS, we have to recognise that the real change is done in operations.
I started off as representing service users in and around St Helens, and then started getting involved in the business of the trust. And I've ended up representing service users on various committees, and also done various audit work, etc. within the trust. An individual can say directly in the way they want to say things, when they want to say things, those particular things that bother them, as opposed to saying something to me or through a group or whatever, which may or may not wend its way through to the powers that be. And how do you pull together all the voices and come up with a coherent message and move to that point where what I want to say gets heard directly? So the advantages I could see about patient opinion was that it would offer another item on the menu of how voices could be heard. But taking the anonymity, ultimately, there is a bit of safety. You can say it in a safe way, and there's no immediate threat to you personally. You put it on the site, and that's it. I think again, one thing about the usefulness of patient opinion isn't in terms of simply the trust be able to deliver a service better. It's actually also saying to its customers, to its patients, to its carers, to staff, that the person matters, that actually when you put something on the site, you've got to believe that I matter.
I've just been talking to a carer who was saying that she used it for that reason, because she felt if she'd have given her name to staff, it may have come back to the person she cared for, and she didn't want them to think she'd been interfering, even though it's not interfering. So different people can use it in different ways, and it is anonymous. So anything that people tell us, there's no fear, there's no comeback. We were very aware at the beginning of our work with patient opinion that some people thought our service users couldn't use this, was too vulnerable, somehow needed to be protected. We spoke to our service users, and we've done a lot of work with patient opinion, going to user groups and going to different meetings, and what they said is no. They are very vulnerable people, and that means they need more access. All the NHS scandals have been where there's been no light shone in services. The more light we shine in services, the better the services will be. The more open they are, the fairer they'll be, the more they'll meet people's needs.
What we found is that because it's an opinion that's posted, patients and families feel far more easier posting an opinion. It doesn't feel as bad as making a complaint or giving positive feedback. They don't have to put pen to paper. A lot of our service users of the younger age group, they love using it as a way of communicating, and we'll very often, when we see them in meetings or in other forums, we'll say, oh, I've put a posting on, wait till you see it tomorrow. So we all wait then for the posting to come through. So it's become quite part of the culture now of our locality. That's an easy way to give an opinion and to get some direct response and some active feedback into that, why their experience is that way, and then for us as operational managers to do something with that. We work with very vulnerable client groups, and they find it difficult at times to have a voice that is heard, but with the easiness of using the internet and the website, that's really positive for them, that again they're just posting an opinion saying that their experience of what it's like working with us and being part of our trust and our services.
It was very interesting that during the developments, we realised that managers were very much more at ease if actually the postings came to me as the lead for patient public involvement and also the PALS officer. But it was more important to the trust to ensure that the messages got out to the staff on the ground, that it was their responsibilities, and that's why we engaged with the heads of services, so that they themselves had ownership on the issues, but also they would also have ownership on what actions were taken locally. And this was very important to us as a trust.
That's not to say that all the comments are positive, because the reason we've signed up to patient opinion, it's nice to be told when we're doing things well, but it's more important to be told where it's not working. We really value the criticisms, the negative comments. There's more for us to learn in the negative comments. Negative comments means there's scope for us to improve. But like everything else in PALS, we have to recognise that the real change is done in operations. So it can't be seen that this is something that PALS deal with, that it just goes to PALS and it's almost sidelined. It's got to be part of the main business of the trust, the main quality improvements. These comments go as an email straight to the head of service. That's the person responsible for the area where the comment's being made. They can make a comment, they can make a response to the comment, but more importantly, they can take action in their service. For us, one of the unique selling points of patient opinion is the way the comments are done in the person's own words. These are real stories, and you read them and the people come across. I can read a report which gives me percentages, gives me outcomes as numbers, and they're valid, they're real. But the patient opinion information sits on top of this. It humanises it, it makes it real, it makes it into real people.
It's very beneficial for me because as a locality now, we're getting far more feedback than we ever got, which is very beneficial for staff. Staff, benefit from seeing it from the other side of the fence, as it were. So it's really beneficial. people and comments are coming through that you would never have heard years ago. It's really user friendly, and as I say, as a manager, I get to know that nitty gritty stuff that at times you're not able to get to that front line constantly to get that direct feedback. So it's really enabled more feedback into the trust and the organisation for us to learn from that and make positive strides forward. With the patient opinion website, because it's an opinion and not an official complaint, as it were, staff do view them differently than a complaint. So when you get a positive posting on the website, staff personalise that sense of, oh, that's great, that's about me, it's been shared publicly about me, it's not being kept a secret and just published to the trust. So it's very rewarding for staff to get that direct feedback. And we do use the feedback, both positive and negative, as an agenda item in our monthly meeting with all the managers to spread that round to staff. And again, both the positive and negative are printed off and put across the locality for staff to see if they haven't had time to access the opinion website themselves. So the reality of working with patient opinion is that each day, obviously you check on your emails, and there's usually a nice little email of "Dear Maria." It's very personal, makes you feel part of an organisation. "Dear Maria, you've had a new patient opinion posted," and you click on the link and that gets you straight in to the actual posting. You don't have to register with your, although I have a password, I've never actually used it officially, but it's a nice, easy, friendly way of being able to click onto it and get straight onto the opinion that's been posted. And you also get messages of when I've replied to an opinion. You get the message saying that's gone on as well. So it's just an inbox icon saying, "Dear Maria, have a look here if you don't mind." So yeah, it's really easy to use and user friendly.
Patient opinion is actually part of our overall menu of service user experience. We've got the National Patient Survey, which unfortunately provides very much a snapshot, which is normally 6 months out of date by the time we receive the information. Reports on the postings from patient opinion are regularly taken to the Patient Public Involvement Advisory Group of the Trust, and also regularly reported to the Trust Board and Trust Management teams. Throughout the year, we have between 10 to 12,000 service users who engage with our services at any one time. It's very important to us that we offer a menu of choice to service users about how they share their experience. Not everybody wants to actually sort of come to a face-to-face meeting. Not everybody will actually share their experience when they're actually engaging with staff on a face-to-face basis. And it's also very important to understand that sort of modern technology is really introducing a new wave of actually sort of sharing people's experience.
When I first started working with patient opinion, something that came as a shock to me was how much talk and how much communication already exists on the internet about the NHS. And after we started with patient opinion, I just done a bit of trawling on the internet, and I think it's very interesting. And the amount of people who are saying things, the amount of photographs of services, of buildings, the amount of chat rooms that are already talking about us and talking about our service without us knowing, and the amount of misinformation that people are spreading that I haven't got the chance to put my point of view. This is a way for the NHS to tap into changes that are already happening, whether we like it or not. Somebody goes in a chat room and says in the 5 Boroughs Partnership they do A, B and C. I don't know about it, let alone say, actually we don't. Somebody goes on patient opinion and says 5 Boroughs Partnership do A, B and C. I can deal with it.
There is the potential to improve people's lives by patient opinion being there. And I think, to my mind, there can't be a greater ambition than that people can say what they want, when they want, in the way they want to say it. The bottom line is that it's there to improve the health and well-being of an individual, me. Patient opinion gives them the opportunity to deliver on that.